Okay, it's 11 o'clock. Why don't we get started? First of all, I want to wish everyone a good morning or afternoon or evening. I guess it depends where you are. And thank you for joining us for the Board of Certification's Continuing Professional Certification Concept webinar and panel discussion, along with some questions and answers. So why don't we get started here? My name is Pat Sexton. I'm the current president of the BOC Board of Directors. Myself, I'm currently a professor of athletic training at Minnesota State University in Mankato, Minnesota, and I've been an active athletic trainer for, well, let's round it down a little bit to say for over 35 years, and I'll leave it at that.
And my name is René Revis Shingles, and I'm the vice president of the Board of Certification Board of Directors. And I've been a certified athletic trainer for over 30 years. I'm an educator, and I'm still practicing clinically at Central Michigan University. As we get started, please submit your questions for expert panel via the chat function located in the toolbar. Click on the icon and type your questions into the box that will appear on the right of most of your screens. For those of you using mobile devices, you can tap on the screen to reveal the toolbar, then click the three dots and click the chat icon. We'd be happy to take your questions. Our purpose today is to discuss and offer some clarification for the Continuing Professional Certification, or the CPC program concept. The first portion of this webinar, we're going to provide you with some background details of our CPC. We're going to tell you a little bit about our vision and discuss some of the research and some of the things that we've learned along the way. We're going to alert you to some opportunities that you have to participate with us in this process. In the second part, we're going to welcome in our panel of experts to answer some of your specific questions. And that panel consists of Larry Cooper, Douglas Gregory, and Susan McGowan.
So, keeping athletic trainers at the top of their game. Our vision is to create a professional development program that puts the athletic trainer at the center. Something that gives athletic trainers a path to learning opportunities that can be customized to meet their needs, their practice settings, and their interests. We want to do this and be able to provide affordable, equitable, and flexible ways to meet your continuing education requirements to keep us all at the top of our practice. We also want to make sure that we're taking advantage of technology to make all of this easy to manage. Why is this important? Well, it's because your ATC credential is a practice credential, and as healthcare professionals, we owe it to our patients and our profession to stay knowledgeable and current and very well trained. In order to be effective, this program has to be affordable and manageable for athletic trainers in all practice settings, from full-time practitioners to casual ATs to those not currently practicing. So let's start with a little information and clarification, as Renee said, on the proposed program elements that are in development. We have piloted many of these over the last couple of years, and many of you have participated in those pilots, and we thank you for that. We're really trying to give the athletic trainer more options that are more relevant to your daily work, options that put you in control of learning and professional development. There are three focus areas, or pillars as we've called them, that support this conceptual framework. The first focus area, or pillar, is professionalism, and the real tool here is the Professional Goals Appraisal, or the PGA. The goal of the PGA is to give athletic trainers a better way to map out their own development path. The PGA is basically a tool that matches areas, formats that you prefer, topical areas, et cetera, that will most benefit your professional development and match those to specific approved courses and activities. For example, if you're working in a team or a clinic that does primarily upper extremity or shoulder assessment or rehabilitation, you're probably going to have more of an interest in those continuing education activities, and this will help match you to those and help you find those, and not only just find them, but find them from approved providers and in formats that make it useful for you. Our goal is to make it easier for you to find those courses and activities and match them to your needs. And that's something that from our research and feedback over the years with the BOC that athletic trainers have been asking for. You'll actually be able to do this PGA and get credit for it as well. Okay, we're building the system that will also help support the technology that will help us map this out. The second focus area, or pillar, is that of continuing professional development, and that includes two options for you. both the traditional CEs and CAMs. I'll talk about those here in a second. CEs are the continuing education activities that you've known and loved for a long time. They will continue to be a major component of the Continuing Professional Certification, or CPC program. The CAMs, or Competency Assessment Modules, are essentially professional articles that are most relevant to you in your practice setting. You read the articles, you complete an assessment based on the articles, and you get credit. Most athletic trainers are reading journals anyway, and when we can take those articles and put them together in areas of interest to you, that will provide topically relevant set of articles with current information that will help you as an athletic trainer, and again, you get credit for it. Okay, the third and final focus area or pillar is practice performance, which includes quality improvement, or QI opportunities. This is an area that I think is drawn a little angst from folks, and really, hopefully we can relieve that. But the idea here is to allow athletic trainers to tap into things that you're already doing in your practice, to find an area that could benefit from possible improvement, determine what that improvement might be. An example, we did a pilot with many of you on hand washing, because we know hand washing rates in all allied health settings need to improve, because hand washing will also lead to reduction of illness transmission. And I think that's pretty relevant today with the pandemic. So if you find something that needs improvement, you can take a look at it, you can implement, and then assess afterwards and write it up to determine whether or not that improvement was useful or necessary. In the end, your work setting gets a meaningful improvement, or not, because sometimes we find that, well, that really didn't work, that really didn't improve. Your patients benefit, you benefit, and you learn something so you can receive credit for it. QIs could be completed individually, they can be completed in groups, they can be completed interprofessionally. Athletic trainers can tap into their colleagues. Maybe it's something your work setting or clinics are already doing. You determine the QI project, you put it into place, the brief write-up, and you get credit. These are proposed as optional, okay, with the goal of allowing athletic trainers to do something that they're already doing in their work setting, possibly improving their practice and getting CE for it. For all of these, the actual activities, the specifics, and the supportive tools remain a work in progress. They're still being honed. We're still working on this. That's why we're rolling this out this early. There will be an option for you to start incorporating many of these into your individual CE plans as early as next year. And it's a great place for you to try them out and provide us input. Just as we did with the pilot projects, your feedback will help us further refine the tools and the activities being considered with the options themselves. So please consider taking these and giving us your feedback on them.
So there are many steps in this process. As you can see the arrow, here's where we are today. And you can see there's a lot going on with the CPC development. This just didn't happen yesterday with the rollout of our call for information. The BOC has been tackling this since 2011, and some of those initial discussions led to the formation of our MOC Task Force in 2016. And in 2016, they did their work. It continued until 2019, and there were three things that they were tasked with doing. That was identifying the activities and tools for continuing education beyond just CEs, recommending ways to improve the recertification system that allows for a variety of options, and three, to identify the specifics of our CAMs and the topics that can be that can qualify for CE credit. And then the task force developed the framework for the CPC, as well as the components of the competence assessment module, or our CAMs. Later, the group recommended that an advisory panel be formed, and that led to the creation of what we now have as the CPC advisory panel. So the current CPC advisory panel came out of this initial group. Over the last few years, programs were piloted, as Pat mentioned, and these pilots included our CAMs, one that was on mental health, the PGA portfolio, and as Pat mentioned, the QI hand hygiene, and also our facilities principles. And these were, there were over 1,400 ATs who participated with these pilots, and we had some really positive results from that. Some of the results and the learning that we had led the BOC team toward the current draft. So the draft that you saw of the CPC concept came out of these pilots and the work of the earlier task force. And we introduced that just before the open comment period about 2 months ago. And then, as you know, we had the open comment period, and that just concluded, and it provided additional opportunity for us to gather some feedback, to hear your questions, and to have ATs to provide a voice. As we think about going forward in our timeline, we're still in the early process, as you can see looking at the map. You can still get involved and participate in some focus groups that we'll have coming up, some beta testing that we'll have going on. And this is going to help us to sharpen and refine what this final version of the CPC is going to look like. It will provide you an opportunity, all of you, an opportunity to test drive, if you will, some of these options, the CAMs or the QIs, as early as 2022. So you can have a chance to participate and then give us some real-time feedback with what worked, what didn't, how do we make it better? My 3 favorite questions. We'll be using some technology that's going to help us to build this system so that you can get it into our system and provide us with your information. That'll be happening with our technology support. And also, by the time we get to 2025 and into 2026, we'll have a slow rollout of the new program. Again, we'll be providing education along the way. We'll be providing training along the way. We're going to help you through this process as we develop our CPC. So as I said, there are many voices. We have heard quite a bit from you. The Board of Certification charged the task force to update the CEs. And it's important to understand that we are listening. We are here. We've had a task force. We've had over 1,400 ATCs who weighed in to shape the initial concept that you had a chance to see before the opening comment period. We're still refining this. We've used evidence in order to make some of the decisions that we did as we put forth the concept. And by the time this is final, it will have been shaped of, by, and for ATs. We want your input in order to make this the best CPC process. And some of the voices that we have heard, and in their words, what did they have to say? So as you can see from the 2 quotes that we put here on the PGA pilot and on the CAMS pilot, we've had great feedback on these 2 pilots, and ATCs believe that these tools were very helpful. So you can see what they had to say here. We also had some feedback on the hand hygiene pilot and the facilities pilot. You can see what individuals had to say here. As you read those comments, understand that what we display here is just a snapshot of some of the comments that we got back that was representative of the feedback on these various pilots. So again, the PGA that we used, the CAM on mental health, the hand hygiene QI, and the facilities principal QI. These were some positive things. But we need more feedback. This is not a done deal just yet. We are looking at piloting what we've done, and it is not a done deal yet. So in the open comment summaries, some of the feedback we had there, again, there were a number of responses when we had the open window. And we heard you. We heard you. There was the good, there was the bad, there was the ugly. We heard all of it. And the themes that came out of that, the things that ATs seemed to be concerned about were the number of CEUs and were those numbers going to go up. The CEU portion and the CE portion is going to look very similar to what it looks like today. Is it affordable? Yes, some of what you might do or the options that you may choose may not cost anything, could cost less. If you're doing a CAMS for a particular area, or the QI that you might be doing may not cost you anything at all. These may be a part of what you're already doing. So yes, we're going to make sure that this is affordable. The other issue that we heard about was the time requirements. We indeed understand that athletic trainers are busy. As a practicing athletic trainer myself, I go into clinic. I understand what that looks like and what that means for our ATs who are out in the field and working every day. So we know that you're busy, and we want to make sure through the options that you have Many of those can be incorporated into things that you're already doing and help you on your job. Can it be customized, and how it would work in my setting? We're certainly looking at different practice settings and providing examples for what this may look like. Again, as you have the chance to participate in doing some of the QI projects and doing some CAMs, you can give us some feedback on what worked in your practice setting, what didn't work, and how we can improve this. We also heard some suggestions for the development process of the CPC. And so these align with our own goals for CPC, such as making sure that the process includes AT input. We've done that thus far. We will continue to do that. We've got focus groups that will be happening going forward. We're also going to be creating some real life examples, which we think will help out for people to understand how does CAMS fit into what I'm doing? How does the PGA fit into what I'm doing? How do QIs fit into what I'm doing? So we're going to be looking at and creating some real life examples. And for those of you who continue to pilot some of this, you can give us some feedback on what worked in your individual settings. And then lastly, being sure that we provide transparent communication. Transparency is a part of the core values of the BOC. And we want to make sure that, one, that we're listening to you, that we hear what you have to say. We take all of that into consideration as we're working through the process of the CPC. So yes, transparency is important. You can always find us information on the BOC website. So get involved. Get involved. We encourage you to do so. Many of you are on this. Those of you who are on this call today have certainly shown that you have an interest in this, and we want to continue to encourage you to get involved in this process and continue to help shape what the CPC concept looks like, and there are opportunities for you to join in. So stay connected to the BOC through email, through social media. Certainly you can find us on the bocatc.org/CPC-overview. That's a lot. Let's try that again. The bocatc.org/CPC-overview. So make sure you go to our website and you'll have information. We'll continue to update that as things happen. Again, as was mentioned earlier, try out the CAMs, try out the QIs as early as 2022 as a part of recertification, and then let us know what you think, what worked, what didn't, how do we make it better. We're listening, and again, we want to hear from you. So now that's just a brief overview of what's going on. We see that your questions are popping in. So we are going to turn this over to our Q&A with some of our panelists. So I'll turn things over to Anne Minton, our CEO of the BOC. Anne, take it away.
Well, thank you, Pat and Renee. I'm Anne Minton, CEO of the BOC. I've been with the BOC since 1998 in a few different roles through the years. There's been a lot of growth in the athletic training profession, and we've seen substantial change over these past 23 years. We appreciate you being with us today to learn more about the possibilities ahead for us and for the AT continuing professional development. Now it is with my pleasure to introduce you to the expert panel. The professionals joining Pat and Renee today will be here to help us with a Q&A panel and discuss the future of continuing professional certification. Panelists today are Larry Cooper. Larry is a current AT and practiced as a secondary school athletic trainer for 35 years until his retirement. Larry has been an active volunteer with various professional groups at the local, state, and national levels. Larry has received numerous awards for his service. Larry was a member of the MOC maintenance, or the BOC Maintenance of Competence Task Force from 2016 to 2019, and was selected to represent ATs in the secondary school setting. Dr. Susan McGowan a current AT, recently retired as faculty from the University of New Mexico. Dr. McGowan operates her own medical consulting business, XMed Inc., which has been providing medical services and athletic training services for ESPN and Red Bull since 1993. Dr. McGowan is an award-winning athletic trainer and has served the BOC since 1992 in a variety of roles, including the president of the board of directors. And she's previously served as the co-chair of the BOC Task Force and currently serves on the Continuing Professional Certification Advisory Panel. Both Larry and Susan currently hold the ATC credential. Dr. Doug Gregory is a medical director at Lakeview Medical Center. Dr. Gregory is board certified by the American Board of Pediatrics and is a member of the American Medical Society for Sports Medicine. Dr. Gregory became an honorary member of the NATA and has been recognized by the American Academy of Pediatrics for his long-term commitment to the development of primary care sports medicine. He currently serves on the BOC Board of Directors as the physician director and was a member of the BOC Task Force and also a current member of the CPC Advisory Panel. Most recently, Dr. Gregory was appointed to the National Federation of High Schools Sports Medicine Advisory Committee. So welcome to our panelists and thank you. Let's get started with the Q&A. All the questions are very important and we see those coming through. And while we may not have time to get to all of the questions in the webinar today, we will gather them and provide them on the website in our FAQs section that René mentioned earlier. We've been gathering lots of questions through open comment period as well and throughout the webinar. So we'll lead off with a few of the questions we heard and continue to hear because they're very important to us. The first question that we have heard repeatedly before we get into the specific questions is about QI. I'd like to help us understand the relevance of QI and provide some real examples. Larry, can you start us off with this one?
Absolutely. I think everybody in our practice settings, we're constantly striving to improve and upgrade our facilities and our emergency action plans. If you're in a secondary school, you might be trying to fulfill the Safe Sports School Award or go through an identified pass. And just in pass, there's 74, 75 touch points. Each time that you strive to reach those and you reach those could be a QI. They certainly are easy. They don't cost any money and you can do those on your time.
Great, thank you very much, Larry.
Hey, this is Doug Gregg. I'd like to add to what Larry said. In our pediatric practice, we had to go through some QI and we managed to group together with several other pediatric practices and it worked well. And for those of you who are outreach or athletic trainers with medical hospital groups, you can probably interact with QI programs already going on within your hospital settings. Contact your QI director for your hospital group, and for those of you out by yourselves, you can maybe get together with ATs in your own conference district, school district, and work together on developing some QI projects. It's all a little scary. I know when we started ours, it was like, oh, what do we do? So you can do it.
If I could add to that, Anne, for example, if you work in a secondary school setting and you had a number of skin infections with wrestling and your goal is to reduce the number of infections, it's pretty easy. You document how you're going to go about reducing those skin infections, and it could start off with cleaning the wrestling mat more often than it has been, hand washing, skin checks, things like that. And if you document all that's a QI. And certainly that's part of the past. It's part of the Safe Sports School Award, and all of those things help you fulfill those QIs.
Wonderful. Thank you, Doug and Larry. Appreciate that. Another common theme we hear about is ATs are stretched thin. I thought the BOC was supposed to help our profession and better working conditions or higher salaries. Why are you focusing on this? Those are some of the things we're hearing as well. I'd like to ask Pat to help us with that question.
Yeah, thanks, Anne. I think it's a good question. I think it's important for some clarification also to realize that the BOC is a credentialing agency, and our mission is to provide exceptional credentialing services, and how those feed into and are recognized by other providers, by legislative, regulatory agencies, and so on. So we really need to stick with that in terms of our lane. We do think that CPC, continuing education, is something that is looked at by regulators, and how well we do that continuing education is important, as opposed to maybe going to a conference, registering, getting your X number of CEs, and then going and maybe going to see one or two meetings. That's not all that effective, and that doesn't really help our patients either. And that's something that really all of healthcare is trying to go away as well. So really, we're trying to stick to our lane. We're want to provide the best credentialing services we can, and we want to advocate for the credential. We think this is doing this.
Thank you, Pat.
And I would like to add to what Pat said, and I think Larry can identify with this. As we've retired from our primary settings, we're thinking too, how are we going to get QIs and CAMs, and how is all this going to fit in? And we are stretched thin, that we've always been stretched thin as athletic trainers. And I think this provides an opportunity for those of us that might be retired from our primary setting to stay involved and provide assistance to local high schools or clinics. When I went to a high school about a QI recently, they were excited for me to come in and lead that project. So I think there's other opportunities, if we look at it as opportunities to stay involved and enhance programs and patient care.
Yes, Susan, I would agree with that. And it's an opportunity to mentor and have a different set of eyes on a setting, a clinic or an athletic training facility, and it can only elevate our profession. And that's what's exciting.
Wonderful. Thank you so much. Another area that we've heard a lot about is other types of healthcare providers or professions that are doing this sort of continuing education. I'd like to ask Doug. Doug, do you have any examples of other healthcare providers that are doing this type of CPC?
Yeah, there have been, and thanks, there have been a number of, I've seen the questions coming through about why the change, what's going on this. And this goes back to almost 10, 11 years ago when there were some changes. And I'll speak to this from some of you maybe wonder, well, why is a physician on this panel? This is athletic training profession. I've been involved with athletic training over 30 years as a high school physician, a KD commissioner for 9 years, the end of my 7 years on the BOC. And I have a personal, in that I have a young granddaughter who is 4 years into her professional degree, and believe me, I get a lot of questions from her about what's going on. So this goes back to a white paper developed by the Institute of Medicine that looked at continuing education for medical providers. It had to do with all the different specialties, the medical specialties, and it was a little bit of a revolution at that time in the medical communities through those members, about 11, 12 committees that were part of the American Board of Medical Specialists. And everybody was tired of taking this every 5 to 7 years certification, proctored recertification exam. So the Institute of Medicine looked at continuing medical education, including all healthcare providers. And the way that it was being done with just C's and recertification exams was not the most advantageous or practical way to move forward with continuing education, as already stated, so that we all in our professions stay up to date with what's new, competent look areas. And no matter whether you're in the clinical, traditional AT practice, you're in academics, you're working in one of the emerging fields, it all works on the same. Now, some of the other allied, let's say the National Board for Certification of Occupational Therapists has moved into this arena. They're looking at competencies, credit for that. I think they also in professional service. The American Board of Physical Therapy Specialists is moving in the same directions. As I mentioned, a number of the members of the American Board of Medical Specialists are all moving. And it's all based on this data that showed that what we had doing in the past was not really productive for our professions and for our care of patients. Now, the AT profession, I have to say with my years of experience, always wants to be a groundbreaker and a leader in the world of sports medicine and patient care. And I think we are not going to, and from the task force to the CPC, we've looked at what our healthcare provider groups and organizations, certification groups are doing, and we don't want to emulate anybody, the American Board of Medical Specialists or anyone else, but look at flexible, reasonable program for the athletic trainer and athletic training profession that meets to what athletic trainers need. So some of that is common concepts, looking at what other groups have done. And as I think was mentioned earlier, whether we realize it or you realize it or not, there are a number of groups that look at healthcare providers and what they're doing to stay current in their own fields and their competency. There's the public, whatever we call the public. There are the state and federal regulators, and there are the medical insurance companies that decide on reimbursement. And whether you want to think about it or not, those groups don't always understand what's going on, but they do look and they compare. So they're going to look and compare, well, what are athletic trainers doing in their profession? What are physicians doing? What are OTs, PTs, and other groups that have certification bodies? What are they doing to continue to promote and educate their members so that they continue to practice and give quality care to their patients or groups? So I hope that answered some of that question.
Very good. Thank you, Doug. Appreciate that.
Can I take just real quick, or Doug, because I think it's important. Doug, you referenced back to that white paper from 11 years ago or so, and Larry and Susan might jump on this too because they've been here. But what started off at that time with the Maintenance of Competence Task Force, as Renee pointed out in the timeline, has evolved. The thoughts that were going on then have evolved based on what's going on in current practice and what other professions are doing and why they're doing it. So I think that's important. I also wanted to mention that we did have also input throughout the process from our strategic alliance partners, the NATA and the KD specifically. So I wanted to make sure that I put that in. It's really been an evolutionary process with a lot of input.
Yeah, Pat, the IOM white paper kind of laid out pillars of looking at continuing education. And as you said, things have changed since that initial white paper came out. We've all lived through or still living through the COVID pandemic, which has caused changes. So it was a format for the Maintenance of Certification Task Force to start with, but it's been adapted and changed over the years as it's gone forward. And Mary's been a part of that, and Susan too, is continuing on the CPC advisory panel. So it is an ongoing living change and document, so to speak.
Yeah, Patrick, thanks for bringing that up, that how much has changed. And certainly since when we started the MOC task force, it's changed its name, it's changed its focus a little bit, it's changed a lot. And like Doug said, it's a living, breathing document right now.
Wonderful. Thank you all. Great feedback on that question. Another common theme that we want to be sure and address is that athletic trainer that's keeping their credential, but they may not be practicing or, aren't funded by a program or an employer. How are we addressing the out-of-pocket annual CPC and the ease of use to find continuing education when you aren't relying on your employer? Who would like to help answer that question?
Go ahead, Renee, if you were.
Sure. Well, one of the things that we think about in terms of this is, our plan is to not make recertification more costly for individuals and to be effective. Again, when you are putting together a CAM, or you're putting together a quality insurance, quality insurance, sorry, I saw the word insurance pop up on the panel, so I said insurance, so quality improvement. You can do that in a way that does not necessarily cost you additional funds with regard to that. The CEs are not going away at all, but QIs can potentially be done with a variety of people. It can be done in groups, it can be done individually, that would not necessarily cost you any resources out of your pocket to do that. In terms of the CAMs, what is it that there's an area that's important for some individuals have talked about not working in traditional settings. So for example, if you are an administrator, we do have healthcare administration as one of the domains of athletic training. So there are some ways that you could potentially do projects, or that you could potentially do reading with regard to the CAMs that relate to administration types of responsibility that athletic trainers have. Not everybody is, taping ankles or evaluating shoulders. And so it's, what are you doing in your practice, as long as it meets the domains of athletic training? What are you doing that you can learn more about in order to move your continuing education forward?
Great, thanks, Renee.
And tagging onto that also, in terms of cost, these proposals, these options are not in addition to the CE, they count towards the CE. So when we say you get credit, we're not talking about, as we have now, 50 continuing education credits in 2 years and then adding these projects on top of that. These will contribute, sort of like EBP was included in your CE over the last 8-10 years. So I want to make sure that was clear as well.
Great,
Yeah,
thanks, Pat.
I would like to elaborate on that. It's kind of what Larry and I were talking about as, the way to mentor or to get involved in other programs to enhance patient care, to enhance our own education and professional development. I think these will provide opportunities for individuals that don't necessarily have the funds, means, or availability to travel to get CEs, or whether it be state, nationally, or otherwise. I think it's going to broaden and open up the opportunities for credential holders to maintain and enhance their credential.
Wonderful, thanks all on that. And from myself too, the concept that we're creating does not really include an increase in required continuing education. In fact, it may turn out that the number of CE required may decrease. So our goal is to make CE count and not count CEs. So we're always looking at ways that we can make what you do on a regular basis, day to day, to contribute to continuing education. So one other question that we want to get to before we get to our list in front of me is that we've said that we have flexible options. I still don't get what that means. That's what folks are saying. They still don't understand what does flexible options mean. Susan, how about you for this question?
Absolutely. As Renee and Pat and you have mentioned, this has been an ongoing evolutionary process since 2016, April 2016, if you want to be exact, April 3rd. And it stemmed from a conversation of what you just said, and making CEs count, not counting CEs. Did I check this category? Did I check that category? But more of creating some flexibility for the athletic trainer to enhance their education, but ultimately enhance patient outcomes. And so with that, we're working with if you look at like the PGA, the Professional Goals Assessment Tool, you're getting CEs just for completing that tool. And what that tool will do is help you as the AT identify gaps of maybe learning areas that you need to focus on and enhance. And that will allow you then to pick significant or deliberate CEs that will bridge those gaps, bring in data, bring in research to enhance your CE process or enhance your knowledge. So I think in terms of flexible options, that's what we're talking about is one, let the ATs identify areas that they want to focus on. And two, I hope this enhances our providers with quality programs to answer those gaps, to enhance our knowledge and skills and abilities, which ultimately will lead to better patient outcomes.
Great. Thank you, Susan. And while we're on that subject of PGA, we've had several questions come through regarding the PGA. One, will the PGA limit what we can do for CEUs? And that answer is no. But this PGA assessment tool to some sounds like an exam, more stressful than helpful. So why is that important? I'd like that, maybe Doug, if you'd like to answer that question.
Yeah, I think going back to my initial statement about the old time 7-year proctored exams where you had to leave your practice and take it, and people felt, well, all I did was study for an exam, but improve my knowledge or my care of taking care of my patients. So the PGA, I think, got rumored that it was going to be a test, but there are questions at the beginning, but those questions are to help the athletic trainer determine where the strengths, weakness are, what their development is, what their development could be, and then to use that PGA, looking at all the various options that have been discussed, to formulate a plan to move forward so that continuing education and professional development is meaningful to the athletic trainer, no matter where you are, as I said, in a traditional clinic AT or you're in one of the emerging fields. It gives that to really look at all these different arenas and not just having to go and sit and listen to a presentation and then make a check off that you were there. So it's meant to be more meaningful and meant to actually act as a guide, if you want to use it that way, to direct your professional education so that it's meaningful to you. We want it, the concept that we've talked about way back from the MOC Task Force to now to the CPC Advisory Panel and working with the ex-staff at the BOC is, this program needs to be efficient. We want it to be user-friendly. We want the time frame to be useful and not onerous, and cost containment. So those are elements that go with those first. So nobody wants a proctored certification exam that you take 5 to 7 years. I think that's gone in the past. And it really was shown in some research papers, and I can't quote them, but presented to us on the CPC as not being productive to really encourage or increase professional development. So I think that's where that stands. Don't be scared. We're not proposing a certification.
Doug, I think it's important to say this is a blueprint for you as an athletic trainer for your continuing development, not a blueprint for the BOC to track you and make sure you're staying on task. And if your practice setting changes or areas of interest change for a variety of reasons, your continuing education should go to that, not what you did on the PGA when you first did it. So I think that's really important that people really understand that it's a blueprint for you. Can we get, as the BOC, maybe some information to provide to approved providers on preferences and needs for you all? Certainly. And approved providers want that information as well, because then they can they can set their programs to match what folks need. So I think it gives a lot of different things, but I want to tell you what it wasn't also, because I think people have that angst and say, this is how you're going to track me. And no, that's not it. It's a blueprint for you as athletic trainers.
Right.
All right, excellent. Thank you so much. So we've got lots of questions.
If I
Go
could
ahead.
add to that,
Sure, Larry.
my guess is that everybody on here tries to look and create improvement in their practice setting, whether it be, make it more efficient, improve patient care, improve the environment that you work in every day, whatever the case may be. Those are all experiences that create an opportunity for learning and for using this new way of maintaining your credentials. So I think that, people don't understand the angst comes from not understanding that, the BOC put out a free facilities project, what do they call it? The facilities principles. That right there in itself can be an opportunity to get a QI or get CEs that are meaningful for you and for your facility.
Thank you, Larry. Okay, another question for the panel. Do we have to complete something from each pillar? I can help answer that one. And that is to be determined. So there's several things that we don't have completed yet at this time that we are continuing to work on. That would be one that has not been determined yet. Let's go back to Renee's timeline that she shared with you earlier. We still have a lot of this work in progress. So that one is a to be determined. Another question, can QIs be done with athletic training program students trying to improve program outcomes?
I'd like to maybe tackle that a little bit. Part of what we have to do as ATs is remember that our AT credential is a practice credential, and it is for us as practicing athletic trainers. Now, could we, have our students involved in what that QI looks like that helps them educationally, but also improves patient outcomes? Absolutely. It's a great way to teach our athletic training students about what's coming down the pipe and how to improve patient outcomes via some type of QI project. But we also have to remember we have to tie that into making sure it's looking at patient outcome, not just educational outcome, because the educational outcome piece is going to be what we have to do for Katie. That's what we do for accreditation, not what we have to do for the BOC credential. So do remember you have to keep those two things separate. They sound like they're the same. What we have to do educationally for our athletic training programs and for the accreditation of our programs is going to be different than what we have to do to maintain our credential as a certified athletic trainer or a licensed or registered athletic trainer, depending upon the state that you're in. But can they help each other so that what you are doing as a part of a particular QI to help educate students about QI? Absolutely. Sounds like a great way to get them involved in that process, but we have to keep in mind that it's about the patient outcome. Those students may have some learning outcomes that go along with what you're doing for your patient outcomes.
Thanks, Renee. How has all of this changed with COVID and the increase in webinar style education?
I don't know that it's changed that much with COVID and webinar style education, other than the fact that there's a lot more virtual education going on. I've seen CE opportunities during the COVID pandemic almost explode. We were worried about the opposite happening, and they've almost exploded with free and low cost virtual CE opportunities. I think that some of those things will be here to stay. I think some of that remains to be seen with approved providers and what happens with face-to-face conferences and so on. But I think a lot of the virtual CE from approved providers, I think that will stay.
Yeah, if I may, I agree with Pat. I think, as I mentioned real briefly, I think this is going to enhance the programs that we will see in the future. I think our approved providers are going to step up and truly participate. Our strategic alliances on board. I think you'll see an enhancement in programs offered.
Yeah, and along with that, our goal is not to compete with the NATA or any other organization that provides continuing education. Remember that the NATA, or you may not know, but the NATA or GLADA or MATS or any of the various organizations, they're approved providers. And so we would not want to be in conflict with that. We're going to provide them any information that you share with us about what your needs are. We certainly help our approved providers to know that information so that they can provide the type of continuing education that helps to meet your needs.
Thank you so much. Okay, next question. What will be the process for the targeted AT input and focus groups? Sounds like you are handpicking people who agree with you.
I would like to say that after we heard the good, bad, and the ugly, let me tell you, we ain't handpicking anybody that's automatically agreeing with us. No, but we will have an open call and we'll have an opportunity. Go to the website as we post that information. So if you're interested, targeted meant we're targeting athletic trainers. We want athletic trainers, not targeted as we're handpicking individuals. So maybe it was the language of that statement that led you to believe that, whoever asked that question. That's not the case. We want to make sure that we hear from athletic trainers, and I've seen a lot of things that come across the chat with regard to those in the 20 or 40-year-old age range. Nope, I'm not there. I've been there, but I've come past that. But we certainly want across the demographics, the age demographics and the year certified demographics to chime in. They have been chiming in. We want to continue to have the group chime in. And as we post things on the website, you'll get information via our emails and other things. Please, 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 please get involved. Or send us an email and say, I want to get involved. You don't have to wait till we post it on the website. Send it to us early, and we'll find a way to get you involved.
And I was just going to say that as well, Renee. We want people to be involved. We want to be transparent about this. There's no handpicking going on. In fact, with some of the social media comments, we actually reached out, and many of you might have had reach outs from the office. We did as much as we could to try and reach out to people who had questions and did not agree with some of what they knew to be the current proposals. So we're really not handpicking anybody. We really want people's opinion. We want you to participate in this process. And when we say this is not a done deal, this is not a done deal. I know people are asking for a lot of specifics on things, and specifics are still to be determined. These are still works in progress.
Oh, thanks, Pat. Renee, I agree. We want to have a wide range of practice settings. We have to. We want to have some interdisciplinary, some interprofessional representation as well. So we will be reaching out for that.
And I'd like to add that looking back and talking about open discussions, freedom of ideas, dissenting, and I think Larry and Susan can agree with me. On the original task force, we had a varied group of people from areas within athletic training, myself and another Dr. Jim Kinnick as physicians on it. And there were some very honest and open, deep discussions, and it was not always agreement to forward and decide what is really best fashion. And we've seen the same process take place on the CPC advisory panel, where there are some open discussions and disagreements about ways to go. And I think we want to continue that, definitely, in hearing from the certificates and experience with athletic trainers is most are never reticent in expressing their opinions, whether it's agreement or disagreement, that athletic trainers are certainly willing to speak up. So I guess the plea out there is if you have concerns about where the program's going, it's only going to get better and meet your needs if you make those comments. But please make the comments with some constructiveness to it and not just a negative comment. Let the staff at BOC and the CPC know, okay, I don't agree with this, but here's what I think, and maybe you can consider this. Just negative comments don't help any of us.
Thank you, Doug.
Yeah, I'd like to add to that if I could. You know, we had some spirited conversations within those meetings, and I know there were individual spirited conversations as well, to try and get a point across, or to get a point of view and let it be known. And certainly we walked out of there, all of us, better because of the discussions and the viewpoints. And as a result, that's why we've seen this evolve and change into a better product than when we started.
Thanks for that feedback. We are at about a 5-minute mark, and I do want to get one more question in, which is something that I can answer before we open it up to the panel for conclusion. But where is the evidence that changes in continuing education requirements were needed? And we do post that on our BOC website. So through the past, since at least 11 years, we have been collecting a lot of research and data, and those are on our website to share with you. Please contact the office if you need help trying to find those. But we do have just a few minutes left, and I want to give the panel some time, a minute or two each, to just, or a minute, to reflect on today's panel or any additional items you'd like to share.
I can start off, and I think a couple things I wanted to make sure I included here were, there's a lot of misinformation and a lot of assumptions that are being thrown about out there. We have been trying to publicize this for a long time. It's been in our newsletters. You can go back to our newsroom link on our website and look at the newsletters. We've done presentations at conferences and meetings for a long time. This has been an ongoing process, but it seems new to everyone because now it's closer and it's more important, and we understand that. So, the past is the past. What was done there was done there, but we want to get the information out, and we want to answer questions, those assumptions. The FAQs, the questions that we have not been able to answer, my chat stopped at 99 plus. That's all it says. We will be including those on our answers to those on our FAQ pages if there are answers yet. And if there's not, there won't be any answers yet, but there will be as we get them. Please, 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 you can continue. If you want to continue to make comments on social media, that's great. But as Doug said, give us some constructive feedback. Reach out to us, okay? Because that's how we really need to hear from all the ATs out there, because we're being right up front. We want to make this work better for ATs. We want to make this more useful for you in all practice settings. So please reach out. Please get involved when there are opportunities for focus groups, for chats to participate in additional pilot projects, or to incorporate some of the new options into your CE plans. Please take advantage of that and give us feedback.
So if I could go, I just think that if we look at this, with a clean slate, and you look at all the ways that you try and improve your practice, your setting, your athletic training facility, all of those could have touch points and the ability to secure CEs through this new program, if and when all of this goes through. So certainly, we have opportunities, we have experiences that will help us get CEs and improve our patient care. And it ultimately comes down to what you as the AT want to improve.
Thanks, Larry. How about you, Renee?
I think, again, Pat touched on a little bit of what I wanted to talk about in terms of getting involved and helping us to know what can happen. There were a number of questions about the different settings, and particularly for individuals who are working in the PRN basis or maybe a part-time basis. Even if you're working PRN or part-time, you still want, I'm assuming, good patient outcomes, that whatever the services that you're providing with whatever time frame for which you're providing those services, to be good patient outcomes. So what are the things that are important to you as a PRN ATC or AT that can help with patient outcomes? How do you think about your role as a PRN athletic training, providing those type of services that still do good patient outcome? What are the outcomes that you want from the various events that you work? So as you think through those, we may have to be a little bit more creative. And as you think through those, give us the feedback also of what might be working and things that might work for you. Because each person working PRN works a little bit differently in terms of how they provide those services. So we would like to hear that feedback of what you think might actually work in terms of a QI type of project, or who you might work with. In some PRN events, you're working with a team to take care of the Boston Marathon. So are there things that you can do to make the Boston Marathon better in terms of the medical care that's being provided for those participants? So could there be an interprofessional QI event that takes place to provide better care for that one event? So those are ways that you can think creatively for individuals who are working on a PRN basis.
Thanks, Renee. How about you, Susan?
Yeah, I think, well, I know in order to grow, we have to change, and change isn't always easy. It comes with challenges. ATs have done an amazing job of adapting and growing during this pandemic situation. We have changed. We have adapted to what has been in front of us, as we always do. The BOC is committed to the athletic training profession. They're committed to the credential, and they're committed to protecting the public. And I believe, just as ATs have adapted and excelled throughout this pandemic, ATs will also adapt and excel as in different ways of continuing their education, with the ultimate goal of providing optimal health care and protecting the public.
Thank you, Susan. Doug, any final words?
Nope. Maybe
Okay.
Hear you.
Okay.
Well, I guess I'll say something. You know, I've never been one to not use the microphone. So in listening to all this, I see you got a big laugh out of that, didn't you, Renee? But I feel privileged to be a part of this panel and to have been involved with this profession of athletic training now for over 30 years. And Susan talked about the challenges and changes in the profession. I've been in step with you all, going to the degree requirement programs, to the master's degree change, to the Katie changes, and the requirements for education. And now this is a new challenge for the profession. As everybody said, yes, this is scary. It was scary for me as a pediatrician when we went through our changes. But remember that this program is for you, for the individual athletic trainer. Take advantage of the PGA, take advantage of the options, and let the staff know your questions and concerns. As I said before, the way to move forward. To me, athletic training profession has always been a leader in healthcare, particularly for athletes, and now moving into other emerging areas. So I think the goal of this is to show to the public, the regulators, the reimbursement individuals, where athletic training is. Athletic training is a leader. We're not sitting back going by old concepts, but moving forward and being trendsetters. And this is definitely a way to do that for this profession. And I'm glad to be.
Great. Thank you so much to this panel today. Thank you to all of you for being a part of this webinar today on continuing professional certification concept Q&A. A recorded version of this webinar will be made available. I think we were saying it's going to be available by Friday late afternoon on bocatc.org/CPC-overview. Thank you so much for your time.